This is Dr. Downey, Dr. Downey Sleeping. I wanted to make sure to cover in this video the hallmark symptoms of narcolepsy. The reason is narcolepsy is one of the most misunderstood sleep disorders, and while it can be severe, it can also be very mild, and so people can often not realize they have narcolepsy. Their doctors may not realize they have narcolepsy, even specialists, because the symptoms can be very mild. In other cases, it can be obviously quite severe, and yet making the diagnosis and obtaining the right diagnosis can be difficult because of the lack of education about narcolepsy. The first symptom all narcoleptics have is sleepiness. And sleepiness can be profound to the point where they can barely function in life, and their sleepiness interrupts even studying for any length of time. You can't drive a car, so forth. Most people, however, have sleepiness that's not quite that severe, and it comes and goes every couple hours or something, and in some cases it's less dramatic even than that, but sleepiness is evident in all narcoleptic patients. The second thing is cataplexy. Cataplexy is a sudden loss of muscle tone, so you become limp, and it's usually triggered by laughter or anger. And when this happens, it can be very debilitating, obviously, especially if a person just like slumps over. And again, that's the cartoon version. Most people have mild cataplexy, and it can be just a subtle droop of the head or the arm. And even if somebody has a severe cataplectic episode where they look unconscious, they're actually not unconscious. They can hear you. So it's important to understand a difference between seizures and cataplexy, and they're often misdiagnosed. The third thing, the third symptom they may have is sleep paralysis, where upon awakening, instead of awakening with motor tone, they awaken and they can't move. It's a very frightening symptom to have. Again, some patients have it worse than others. I might add that a lot of us have had sleep paralysis, but that doesn't mean we have narcolepsy. Fourth symptom is hypnagogic hallucinations. They wake up and have dreams that enter wakefulness. So it's sort of like a mixture of a vivid dream that's occurring in a paralyzed body, and it can be again quite frightening. And again, many patients or many people who don't have narcolepsy also have the symptom. And last but not least is insomnia. It's hard to imagine that somebody so sleepy as a narcoleptic patient would have insomnia, but they live on a teeter-totter between being excessively sleepy and having difficulty initiating sleep and maintaining sleep, as their sleep is often fragmented. So it's a tough life to balance when those are really extreme. It's important to understand again that these 5 symptoms are not necessary to make the diagnosis. All 5 symptoms occur in only about 10% of narcoleptic patients. So some can only have sleepiness, some can only have narcolepsy with cataplexy, and some people, of course, have all symptoms. And no two narcoleptics are the same, of course, but there can be dramatic differences. Somebody who's very debilitated by this condition and is difficult to treat, and others who are not very affected by it and who may or may not be difficult to treat. So there's help out there. You can go to your sleep doctor, look on the American Academy of Sleep Medicine site, and they may have board-certified sleep specialists in your area that can help you. We don't treat patients here at Dr. Downey Sleeping. It's educational and primarily. So I hope this video clip helps you understand more about narcolepsy, and that if you have it, even mild symptoms, ask to see your doctor and a sleep specialist. And if you have severe symptoms, of course, please see them. If you want more information on this topic or others, go on Facebook at Dr. Downey Sleeping or on Twitter at Dr. Downey Sleep. Thanks for viewing this video.